Hello, everybody. On the occasion of World Cancer Awareness Day, we are here to discuss cancer awareness, prevention, detection, and treatment. The World Health Organization has predicted that the global burden of cancer will grow by 70% over the next 2 decades, with an estimated 22 million new cases and 13 million deaths each year by 2032. The majority of cases now occur in low and middle income countries. In India, cancer cases in the country are likely to increase to 15.6 lakhs by 2025, which is a 12% increase from the current estimated cases, according to the National Cancer Registry Program report of 2020. So we have with us here Professor Pankaj Chaturvedi, Deputy Director, Center for Cancer Epidemiology and Tata Memorial Center, Mumbai, and Srikanth Suryanarayanan, Head Imaging at GE Healthcare.
Thank you.
So let's start. And after we've had these very serious figures that we've discussed, we also, I think, for the lay public, what we really feel is that cancer cases somehow seem to be increasing. And I think in the pandemic, during the pandemic, we saw, hospitals full, and it was said that, you know, people who had cancer, they were immunocompromised, and coronavirus was a bigger risk for them. So do you agree? Did you see that in your field of
So,
work?
yes,
Dr.
so
Chaturvedi?
certainly during the coronavirus pandemic, there were two ways the cancer patients and the community was distressed. One was that during the lockdown, patients could not travel to the hospital or travel to other cities for treatment, and therefore we saw a lot of advanced cancer patients who happened to delay their diagnosis and visit to the hospital for obvious reasons. That is number one. Number two, the cancer patients, because they are immunocompromised either during the treatment or at the time of diagnosis because of their inherent weakness, they had higher susceptibility to COVID infection and COVID related mortality. So that fear also played in their mind. So certainly these 18 months, 2 years were bad for cancer patients. However, Tata Hospital continued cancer treatment during the COVID time, knowing very well that untreated cancer is 100% fatal and COVID has a mortality rate of less than 5%.
Shrikant, do you agree with what Dr. Chaturvedi is saying?
Yes, we definitely saw a lot of our hospitals inundated with COVID patients, and obviously we have a lot of equipment that's used in cancer care in a lot of large hospitals, and we saw the utilization of the equipment was also quite low during the peak of the pandemic because most of the hospital resources were diverted towards COVID care beds and hospital resources, etc. And obviously, as the COVID recedes, cancer is here. It is here to stay. Patients will need care. So post COVID, we have seen again a resurgence of utilization of technology, and of course, as Dr. Pankaj said, a more urgent need for a resume of care in cancer as the disease progresses. So yes, it is. It has seen a lull during the first and second wave, and then seeing a resurgence now post COVID as patients get back for diagnosis and treatment.
Right. And as you're saying, during the pandemic, I think our entire attention and focus was on the coronavirus, and other diseases took a backseat, even something as serious as cancer. So I think, which is why it's very important to discuss this today, because I think we need to not neglect, such a dangerous disease, which is, of course, now thanks to technological advancements, etc., manageable as well, which we'll talk about later in the conversation. So, Dr. Chaturvedi, I think what everybody wants to know, like we're saying, we hear about cancer cases all around us, right? So tell me first of all, who can get cancer? Is that any typical person? You can say any lifestyle habits, etc. Who is a typical case for
So,
cancer? Let's say,
two-thirds of the cancers.
and is there such a thing?
Good thing
Yeah,
about cancer
yeah.
is that two-thirds of the cancers they are related to lifestyle. That means that we are responsible for them. So we can't blame anyone else for that. And another half of the cancers they are suitable for early detection. That means you can detect them very early in a stage where they are curable. Therefore, cancer, unlike hypertension, tuberculosis, or diabetes, if detected early, can be a short term treatment with a very good survival. So, what is important that people should change their belief that cancer is a death warrant. Why? First, we buy cancer, tobacco, alcohol, areca nut, marijuana, all these kinds of stuff that we buy to get ourselves ill. Two, we delay detection of cancer by some fear in the mind that if I go to a doctor with warning signs and if I am detected to be cancerous patient, what will happen to me? So this fear and affordability also, accessibility also drives the people to delay the diagnosis and present in advanced stage. So you can imagine a paradox. I'm buying cancer, I'm delaying cancer, and then I'm blaming cancer for everything.
But there's some good news hidden there that if we are responsible, then we can, we can, if we avoid these warning signs, and maybe we can avoid cancer. And I think, as Srikanth will point out, diagnosis is key, right, to early detection and treatment. I think there's good news there as well, because I think there's a lot of advancement and a lot of new tools which are available. So, Dr. Chaturvedi, you mentioned marijuana, alcohol. So now we all know that tobacco is, dangerous to one's health. But is marijuana, is considered recreational in some countries? It's even legal. It's also considered, as helpful during the treatment of cancer. So, tell me, is it as serious as
See, first
tobacco,
of all, when
marijuana?
you say that we know that tobacco is harmful, imagine
Yeah.
almost 30% of India's population is still using it. I'm talking about 270 million Indians using tobacco. And if you go to the colleges these days, though we might have warnings on the cigarette packets, and every mother and every father and every teacher might be telling students not to have tobacco, but it is very popular. So, knowledge is not converting into action, and people are not quitting it, rather picking up, especially the women. Now, what is a very urban phenomena, smoking in women. I do not know why women were supposed to be very health conscious, and now they have moved to taking smoking. Now, coming to marijuana. See, tobacco industry has heavily invested into marijuana, and the reason is very simple. They see a future in marijuana where the youngsters may move from cigarette to electronic cigarette or marijuana, and that is the future for tobacco industry. We can't trust them. Marijuana, two short answers. A, the medicinal property of marijuana yet not proven. US FDA has approved only for one rare kind of epilepsy. That's it. Yes, it is smoked, it is consumed, it has got lots of hazardous effect on human health. It is proven beyond doubt. It is harmful, and its beneficial role is not proven, and therefore this entire lobbying that it should be legalized is bereft of any evidence.
And you mentioned e-cigarettes and vaping. So vaping was considered an alternative for a while now to, tobacco use. So
See,
you have
vaping,
something to say there as
the
well?
fundamental ingredient of vaping is nicotine. Nicotine is the substance which causes addiction. It is much more addictive than even heroin and cannabis and marijuana. It's very, very addictive. And that is why, despite the warning, people are not able to quit tobacco. Now, this nicotine, when you put in a cartridge and allow people to vape, the industry says, the manufacturers say that it is safer than cigarette. Now, less harm does not mean no harm. It is like saying that jumping from third floor is better than jumping from the 13th floor. That's illogical. Moreover, nicotine is a poisonous substance, it is a toxic substance, and our children should not pick up this habit by false belief that it is safer than cigarette.
So what we're saying is that, whether it is tobacco, whether it is vaping and e-cigarettes, or even marijuana, these are all
Yes.
triggers for cancer. Even pan masala, pan masala
So,
is here in,
So,
smaller
Anuradha, you are
cities, and
from
it's very
the
popular.
journalism. I really pity some of the TV producers and TV, industry people who are also unaware that pan masala ads are fueling a epidemic of oral cancer in India. If you open any television channel, you are only seeing pan masala ads. People may be unaware, but at least educated media houses should not allow these pan masala ads, knowing very well that the big B, Amitabh Bachchan, withdrew his entire ad for pan masala, knowing very well that it is surrogate of tobacco, and pan masala on its own, supari on its own, causes cancer.
Yes, that sent the right message. Yes, Amitabh Bachchan withdrawing from this. So tell me, when we were talking, we also spoke about Ayurveda and homeopathy. Do they play a role in cancer? Or and how much? Even if they do play a small
Yes.
role, how
So
much?
see what
Where is the money?
happens that we all practice evidence-based medicine. If there is any drug which is effective, be it Ayurvedic or allopathic, we use it. However, if I have to say as a blanket rule, that does Ayurveda help, I would say that Ayurveda helps in health maintenance. Cancer is an acute illness, and here we need to follow the scientific treatment. And the best treatment is surgery, chemotherapy, radiotherapy. What are the standards treatment? We are indulging in research on Ayurveda. Probably we may find cheaper, more less toxic alternative to the current drugs, but that is under research. But homeopathy, certainly there is no proven benefit.
Right. Yeah, we should not rule out anything that can, help a patient deal with the disease. Right. Shrikant, we were talking earlier about, during the pandemic, access to healthcare was an issue, and people were scared of traveling and the lockdowns, etc. But now that's lifted. But even then, typically what we've seen is that when a relative or a family member is ill, and basically suffering from cancer, the family has to, make arrangement to shift them to a larger city, stay in a relative's house or book a place, and so that is how it's been. You go to the metro cities and you do that. So do you see that changing? And being from GE Healthcare, on the ground, what are your insights?
So, absolutely, Anuradha. I think definitely seeing a shift of awareness and investment in technology and quality of care in tier two and tier three cities. Not just of course in the context of COVID, but also beyond COVID as well, especially in the context of in cancer. I think just stepping back a little bit. I run the imaging business, and one of the critical frontline tools in detection and management of cancer is an imaging device known as a PET CT scanner. Uh, you know, 5 years back, 10 years back, this was largely available in metros and probably some of the tier one towns. And I think in some sense, pandemic has accelerated the need and demand for a PET CT scanner in tier two and tier three towns. And even before COVID, I think GE Healthcare recognized the need for this, that we need to have a very critical frontline diagnostic imaging tool like a PET CT scanner in every town in across India. And if you look at statistically, our access to PET CT per million population is probably at least a fifth or lower than some of the other countries within Asia, like Japan, or when you go westward in Europe or United States. So this was a very important priority for us. So we did do a lot of local R&D. So we have a large technology, organization in Bangalore, where the team collaborated with leading doctors from institutes like Tata Memorial to localize the technology, manufacture it, make in India. And now we are seeing that technology being adopted in a lot of tier two and tier three towns as well. In fact, more than if I look at it in the last 6 months, from a business perspective, the demand for the PET CT scanner in tier two, tier three towns has far outpaced demand in metros as well. So definitely there is awareness, there is investment. Caregivers are realizing that, as you rightly said, for a patient to travel 50 kilometers or 100 kilometers adds a lot of risk. Of course, the financial burden, not to say, on the family members as well. So we continue to focus on Make in India, localizing a lot of the technology so that a very critical frontline diagnostic tool like a PET CT scanner is can reach tier two and tier three towns, and we've seen that in the last 6 months, where this technology has reached parts of interior Maharashtra, Rajasthan, Jharkhand, etc. And a lot of places, this is the first PET CT scanner in their own town. Just imagine that, the first PET CT coming to a town, a tier 2 or a tier 3 town. And that's in some sense, COVID has accelerated that. So that is, as Dr. Chaturvedi was also saying, the awareness of healthcare is higher than ever before, and definitely the importance of technology and life-saving technology investment in that is also moving in the right direction.
Absolutely. I think now we are more focused on healthcare, even taking care of our lifestyles and leading healthier lives. And as you mentioned, I mean, it's astonishing that a PET CT scanner, the first one in a town in, I mean, so many years of independence. It's like for people in the metros, it is very difficult to conceive of such a thing. But I know that GE also is working, and there's newer technologies available, like molecular imaging, AI. There is MI. There's so many things that are now part of one's diagnostic toolkit. So could you, just explain it to us, and maybe Dr. Chaturvedi, you could also explain it what how it means, what it means for a doctor and for the layperson.
So Srikanth can go ahead.
I'll probably let Dr. Chaturvedi lead off, as what does he see as his views on digital and AI. How does it help? And
Yeah.
then I can follow Dr. Chaturvedi and talk about what we are doing in our perspective from an R&D industry
Yeah.
R&D perspective. Dr. Chaturvedi, why don't you lead off?
So COVID has taught us many things, and I think it is a great opportunity for all of us to realize that how we have to adopt technology for our own benefits. And I remember the medicine branch is one of the most resistant branches for adopting technology, because we still believe that human touch and feelings and all those are very important. And that is why,
Right, we need the doctor
yes.
to touch our pulse, so
So
before
what
we
has
diagnose
happened
it.
that
Yeah.
our expectations are different from the expectation of the patients, and this expectations led the entire belief that there is nothing like a video consultation that can satisfy a patient. There is nothing like a algorithmic diagnosis based on AI can satisfy the patient, or patients can do self diagnosis of certain diseases with some kits that they can buy on a pharmacy and use it on themselves. So this entire belief has been shattered, and now we are talking about our own platform where patients upload their, it's called Navya, where we upload all the papers, and based on that we create a summary, and based on that synoptic summary of the cancer, AI enables that what is the best treatment for that cancer, and that AI enabled treatment options given to the patient, when it is given to the doctor, nearly in 80 to 90% it is correct. So now we have patients from Arunachal Pradesh who are able to get report of a doctor in less than 2 minutes, because the doctor has been enabled by the AI and he has to only approve that option, and this allows them to get a second opinion or a front opinion, first opinion, without visiting Tata Memorial Center. Similarly, we have video consultations on WhatsApp, on various platforms. Patients are very satisfied. Moreover, we have self diagnostic kits like COVID, we have those tests available. So, what ultimately we have to understand that we in medicine, we have to keep changing our way of working, otherwise we will become like dinosaurs.
Right. So what you're saying is like somebody in Arunachal Pradesh, without having to visit Tata Memorial in Mumbai physically, can get a report, the first diagnosis, and so this basically saving time, saving
Yeah,
travel costs. It's also affordable and also,
correct,
like you're saying, quite
correct.
precise, 90% of the time. So that's fantastic. Yeah, Shrikant, if you could, explain it
Yeah.
even more.
No, I think Dr. Chaturvedi hit the nail on the head, right? I mean, we know we are a very populous country. We have 1.3 billion people, and I think COVID is a perfect point. Dr. Chaturvedi has brought up that COVID has taught us what happens when healthcare is needed at scale, and then it has exposed. In some sense, it has brought out the challenges, right? We know we are a populous country, but what happens when millions of people need care in a short period of time? You could see, I mean, you just cannot scale manpower to that level, right? You can't have 1,000 doctors tomorrow. You can't have 10,000 nurses tomorrow, right? So you have to depend on technology. You have to depend on digital technologies to be able to scale, to meet the needs. As Dr. Chaturvedi said, you have a patient who is in Arunachal Pradesh. You can't put an expert there, or you can't have as many experts as you have in Tata Memorial in Mumbai, or many of their satellite centers, every town. So you have to depend on technologies to help you scale. And we saw a glimpse of that through COVID. That what happens when you now, where you're serving 1,000 patients, suddenly you have to serve a lakh or 2 lakhs, etc. So I think that's where I think it's a very, very critical lesson that for us as industry to help out caregivers, that how can we accelerate embracing adoption of digital technologies, and that will help them scale their needs to thousands of patients down the road as well. And Anuradha, you started this podcast by saying that cancer incidence is only going to increase,
Correct.
awareness is increasing, so more and more patients are going to come in through the system. And we have to be able to we are not going to be able to produce so many x more doctors and nurses in a short period of time. So in that period, it is going to be digital technologies that we all have to embrace and adopt. And as industry, we have to keep developing for doctors like Dr. Chaturvedi to use to be able to scale our healthcare system.
So, when we talking about AI, there's also molecular imaging, theranostics, which is, being touted as the future of cancer. Um, so, could we know a little more about that?
Shrikant, go ahead.
So I think I'll give one context of AI, and then I'll let Dr. Chaturvedi talk about theranostics, and I'll also jump in. So specific in cancer care, I think I'll give one example again, which is called a tumor board, right? Dr. Chaturvedi, I'm sure, is part of that, and he leads a lot of tumor boards. And I think this is an example where AI and digital tools are coming in to support doctors. I think now it is slowly shifting towards what we call as virtual tumor boards. So again, you have doctors. I mean, cancer is a complex disease. It requires a multitude of experts coming together and deciding what's right for the patient at the point of diagnosis, or let's say 6 months or a year after the treatment is started. So a virtual tumor board is a digitally enabled AI enriched tool where multiple experts can come in virtually, right? They can, I mean, any cancer patient is going to go through a multitude of tests, from a simple X-ray to a blood test to a pathology to a molecular imaging scan on a PET CT scanner, etc. So how do you bring all of this data together, use AI to draw the insights, and also bring in experts in a virtual manner to utilize that data to look at what's the right treatment, how is the efficacy of the treatment for that particular patient, should they change course, should they change treatment pathways, etc., and how the patient is responding. So one, combining large amounts of data coming from multiple sources and drawing insights through AI for doctors to utilize, and then bringing a variety of experts together in virtual forums. In previously, it used to be physical meetings that a surgeon, an oncologist, a radiologist would come together and review the case. And how do you make that virtual? Because of COVID, and also because of the scale we have to deal with down the road. As more and more patients come, you have to do this virtually. As Dr. Chaturvedi said, how do you decide what's the right treatment option for a person who is, let's say 200 kilometers away from Bangalore, etc. So I think that's where I see specific in cancer, how AI and digital technologies are coming together, and helping analyze large, very, very wide sources of data, and helping draw insights. So that's one example, and I'll come to theranostics once Dr.
So,
Chaturvedi gives his
Yeah.
views on this.
What I can just see is that, from, a patient going to a doctor, a local doctor, or maybe going to a city doctor, and, sitting in the clinic, and, just getting a cancer diagnosis and discussing treatment. Now the patient has access to a team, which is not limited to this one doctor's room or even that city or even probably in that country. So I think this is huge. You get an entire team working for you worldwide. Yeah. Yes,
So I'll
Dr.
tell you
Chaturvedi.
one example. The commonest cancer in India in men is mouth cancer, and the commonest cancer in the women in the rural area is cervical cancer, and both are superficial cancers. For one, like say oral cancer, the test used for screening is visual examination. That means somebody goes, peeps into the mouth and sees a white patch, red patch, or a ulcer. So now we are doing a study, and that study is in the final stages, where we are just using the mobile health. And in the mobile, the person can take the image, or the spouse or the family member can take image of the lesion, and we have already built an algorithm. So you can have an app which can immediately give a diagnosis, and if there is any ambiguity, you can repeat it after some time. So you can imagine the commonest cancer in India, which is the number one cause of cancer related death in Indian men, it has got a simple solution using your own cell phone. Similarly, cervical cancer. In cervical cancer, HPV, if you human papilloma virus test is done, which can be done at home with the like a pregnancy test, you have your diagnosis at home. And if you are HPV positive, you need to go elsewhere. So all this is happening because the evolution of science is happening at much faster pace than before. In the past, things used to happen over decades. Those things, say for example, the development of vaccine for COVID, other vaccines that took several decades, but this vaccine came in just 1 year. I'm sure this is all because we are enabled by technology. Now, going to the theragnostics, see what happens, why people fear cancer, especially chemotherapy. They fear because it has got toxicity. And toxicity means that these cancer drugs, they are not very targeted. They kill all the DNA with a hope that the tumor DNA cannot survive or come back. However, the healthy DNA or healthy cells will come back into health once again. So that is the only difference. Otherwise, there is no precision. So now we are moving towards a technology where, like a Tomahawk cruise missile, we can home in on the cancer cells. We can only target cancer cells to the precision that no bystander, no surrounding cells will be damaged. And that precision is coming, and it is already being used through the radioisotope tagging, or some kind of modification where the receptors are molded in a way that it only targets that. So this targeted therapy, or I would say theragnostics, is the future, no doubt about it.
Yes, I mean, that sounds fantastic because instead of creating an entire hostile environment in the body, even for the healthy cells, you're targeting exactly what needs to be, the cells that need to be killed basically. So, is Shrikant, the technology is already here?
Yes, it's as Dr. Chaturvedi said, this is the future, and I think we are absolutely in the midst of it. Working with doctors to develop it, and I think so. Basic idea from our perspective is we have the diagnostic devices, right? We have a PET CT scanner, which is a diagnostic device, and what doctors, as Dr. Chaturvedi said, they want to find out what is the specific type of cancer that the patient may be affected with, and what's the precise and specific treatment that I want to give to that particular type of cancer that the patient has. So our PET CT scanners are now moving towards, enabling doctors to say that, okay, I will allow you to combine diagnosis to say that, okay, this could be a patient who has prostate cancer, for example, and then use the same, molecule or that same technology to be able to deliver therapy as well for that very specific organ or clinical subtype. So that is where we are also working to take our imaging or the diagnostic devices and basically enable doctors to deliver therapy as well through that same pathway. So not only can doctors go and say yes, this looks like a prostate cancer, but use that same diagnostic mechanism to go treat that patient for specifically prostate cancer. So that's absolutely that is the future, and we are working with a lot of our leading doctors both in India, outside India, to bring that to patients quicker.
Yeah, so I think this is revolutionary because this what you're saying is that basically diagnosis and treatment are combined. So there is no lag between diagnosis, waiting for weeks, and then starting treatment because that is what typically used to happen and still happens. So is am I right? Is
Correct.
that what we're talking about, Shrikant?
The precise killing is the buzzword. Personalized medicine is the buzzword. The reason is that not like each cell has a personality. Each cell is different from the other cells. Within the tumor also there are cells which are different from each other. So what happens that because of this heterogeneity within the behavior between the individuals and between the tumor and within the tumor, what happens that we always talk of percentages. If we give particular treatment to an individual, certain percentages get cured, not all. Now, this percentage is because of a heterogeneity, and perhaps a time will come when we can target all the diverse group of cells in such a way that this cure rate can be much more than the very small number, less than 30%, 40%, and all that. For that, again AI will come in picture. Again, the personalized medicine where each individual's behavior and cell behavior will be taken in account, and a concoction of treatment will be offered rather than somebody having fever everybody gets paracetamol. That simplistic model may not work.
And I think, Dr. Sadhbhay, I think one of the, looking at the clinical, publications, one of the outcomes which is very promising is, as you rightly said, the precision with which you're treating a
Yeah.
particular patient for that particular subtype, but also seeing the responsiveness seems to be more, quicker and better, when you have a targeted treatment, as you rightly said, compared to a broad-based a treatment method that was used in the past. So yes, it is very precise for the patient, and the outcome is that the response is more efficient. From the clinical publications that we're seeing.
Yes, so basically a simple blood test, imaging, and the new AI tools, you can just simply diagnose the type of cancer and start treatment immediately. So this is what we're talking about really. And thanks to, okay, I should not not thanks to the pandemic, but let's say thanks to the attention on healthcare, I think we have all, like, all of us included, we've got used to, accessing healthcare remotely, talking to doctors on video chat and, things like that. So that shift has already taken place. So I think this session should also educate people on the treatments that are available, the advancements in AI, molecular imaging, and theranostics as the future of cancer. So I think this is quite enlightening. And would you have any concluding comments, Dr.
So
Chaturvedi?
my concluding
Start with you.
remark is that cancer is curable. Let us not fear cancer. A, avoid anything which is unhealthy. And what is unhealthy, you don't have to go to Google. You don't have to go to some gym or some dietitian or some health expert. You just go to your mom, ask her what is healthy food, what is healthy lifestyle. She will tell you. Adopt healthy lifestyle. It will help you in all ways. Forget about cancer. For me, what is more important is the mental health these days. So when you have healthy lifestyle, when you have healthy food, I'm sure you will not fall prey to any illness. And let us hope and pray that nobody needs to come to Tata Memorial Hospital or any cancer hospital, and we are all jobless.
Wonderful
Well said.
note. Yeah, yeah.
Well said, sir. I think while, as Dr. Chaturvedi said, as a part of the healthcare fraternity, I think it's good to see the increased importance being placed to healthcare, and I'm sure that will continue, and that will have a long lasting impact to our society. But I think, as Dr. Chaturvedi said, I think ultimately, importance to healthcare is not just with hospitals and industry and our governing bodies. I think it also starts at home. I think if each of us recognize the importance of healthcare at our own homes, at our own level, I think that is probably going to have a lot more impact than all the great technologies and the clinical therapies that the doctors are coming up with every day. But ultimately, I think better care starts at home, and I couldn't agree with Dr. Chaturvedi more to end our conversation.
Yes, I think we're ending on a very note which inspires confidence among listeners. because I think with the right kind of lifestyle, we can hope to prevent, diseases, and also with early detection, treatment. I think we're looking at a positive outcome in when it
Thank
comes to
you.
cancer. Thank you for joining us,
Thank
Dr.
you.
Chaturvedi and Srikanth, and very enlightening
Thank
for all our
My
viewers.
pleasure.